The big challenge was that at the beginning, we received only case reports. And of course, the scientific value of case reports is not very high, but it was completely new. And in a scientific journal, you have to publish novelty. So at the beginning, we published a few case reports, then small series. And at one moment, after a few months, we had to stop and to say, now we have enough. We know that we may have neurological disorders in COVID. Now we need really scientific papers comparing people with and without COVID and so on. And also addressing the issue of neurological disorders, chronic or acute neurological disorders during the COVID era. What happens, for instance, with people with Parkinson's disease or with MS during this era, because it was difficult to see the neurologist and to follow the treatments, and we had no vaccination at this time. So this was a big difficulty at the beginning. Now it's different. Now the main two topics we have to deal with are first vaccination, and we have even made an editorial for this. We receive, unfortunately, several manuscripts describing a neurological event occurring after vaccination. But this is not a proof that it is due to vaccination. In my country, for instance, we have vaccinated more than 50 million people, so meaning that we made more than 100 million vaccinations. And if you follow all these people for 3 months, you will have people who will develop the Guillain-Barré disease, stroke, headache, and so on. But you have also people who will have car accident, or who will divorce, or will have a fiscal control or something like this, which is not pleasant. And it's not a consequence of vaccination. So we decided that we will not publish single case reports concerning a neurological event after vaccination. We will not publish also a small series, and we will accept only case control studies, well-conducted case control studies, comparing people with and without COVID. Otherwise, there is a risk that these possible neurological disorders occurring after vaccination are used by people who are against vaccination. And it's very easy to do this, to see, oh, this person was vaccinated and 3 weeks later she had Guillain-Barré. This is possible, but this is possible also in people who have COVID. And we should not forget that the vaccination is effective to reduce mortality. So for now, our main focus is on the long-term COVID. And we have some papers coming on the cognition after COVID, for instance, and on vaccination, but we accept only well-conducted case control studies with, we published one. We published one on one complication well described, which is the risk of cerebral venous thrombosis after vaccination. This is something which is proven, it's increased, very rare, and we have published a nice paper, European paper, showing that the strategy to prevent, to treat these patients is effective and reduced mortality. So we are not against publishing complications of COVID vaccination, but provided this is scientifically valid.